I am Jessie Schwartz. I'm a pediatric dentist.
I'm Ellen Stone. I'm also a pediatric dentist.
So Ellen and I opened our practice together about 6.5 years ago, Santa Monica Dentistry for Children. We are both pediatric dentist specialists and have been practicing for around 15-16 years. We were friends for that whole time and decided to open the practice together here in Santa Monica. We also have an orthodontist who's been with us since the beginning, Dr. Alana Norman, and she actually is the one who introduced us to the Breakfast Club. We just recently brought on another doctor, another pediatric dentist, who actually trained at the same program I trained at and had the same mentor I had, and she just joined us a few months ago. Her name is Dr. Alice Kim Bundy, and she's lovely. So the system works very well. When children are at a Santa Monica school, a nurse is part of their health education. They are doing education at the school, and if they happen to note a child who has significant dental needs and they are aware that the family has not had access to dental care in the area or had not been able to afford dental care, then that patient is then referred to our office. They come with a form with information about the Breakfast Club and about us, and they come to the office for an assessment. Some of those patients are evaluated and just need to have simple things like oral hygiene education, a cleaning, a checkup, and x-rays, and just to help them kind of on their path to good oral hygiene and oral health. Other of those children are found to have significant dental issues. Dental decay is very common in school-age children. And so those kids, if they have big dental needs, are assessed by us. We formulate a plan for what care needs to happen, and then that plan is shared with the Breakfast Club so that they know what the situation with that family is. We give them some basic information about the family, but also keeping their personal information private, so we can let them know who this child is, what their needs are, and how much work is involved to get them in good shape.
We tend to see some pretty significant tooth decay in young children. Jessie and I have seen kids with many dental abscesses, facial swellings, kids in a lot of discomfort, and parents who feel very helpless because they can't afford the care necessary to help their kids. We also help kids who have significant bite issues and are maybe embarrassed at school. I know Dr. Norman has helped a few kids and really made them smile again.
So working with the Breakfast Club for the 6.5 years we've been open, we have not had kids then return to the office with new cavities, new issues. It feels like we're able to, and this is true in general when you have a child who has a lot of dental challenges early on. Often if you get a clean slate and there's a change in the mentality of the family and the child about their oral health care, you often can nip this in the bud. So it becomes more of a chapter in their lives, and then from that point forward, they're in a much better place. In terms of early dental care, there are many reasons why this is so imperative. Children who have decay on their baby teeth definitely get higher risk of getting decay on the permanent ones. Some people think, well, baby teeth, they'll fall out, but children, as they get their permanent teeth around the age of 5 or 6, also can get decayed as well if they don't have a good oral health in general. And then that sets them for a path for their lives. So if they are having early decay on the permanent teeth as they're erupting in their mouth, that continues as they get older into teenage and adult years as well. So setting this situation up where they have good dental care and good health from the get-go sets them up for life. In addition, dental decay and pain is one of the leading causes of children missing school. So that, in addition to asthma, are the two big reasons children actually miss classes, because they just have so much discomfort and have to be staying home from school, getting emergency care. So the idea is if you get them in a good track, we're hoping they will stay that way forever.
So when your teeth hurt, you're really not in the mood to do anything. It kind of makes you quiet and sad. And so kids are sitting in class and they're not focused on learning, they're in pain, and they're not talking a lot. Maybe they have visible tooth decay, which other kids can see and make fun of. So I think aside from their well-being, it affects their personality and how extroverted and happy they can be.
We want to thank everyone who's given donations to this wonderful organization. We felt so lucky to be part of this organization, part of what its mission, part of its goals. We felt really like we've touched people's lives and helped them significantly, and we look forward to doing that in the future. We now have a really strong team with 3 dentists and 1 orthodontist, all working with the same goals. We look forward to keep on treating these kids.